Hi, friends. Sorry, this is going up a little late. I tried to fix my this is going up a little late. I tried to fix my camera, tried to reformat SD card, and look, the point is, it's a very simple problem that I should have been able to solve and was not able to solve, and am somewhat ashamed internally. Not like a lot ashamed, but like as a millennial nerd, I have a certain obligation to be able to solve basic technical difficulties that I feel I have not lived up to today. But regardless, still riding high from my last day of inpatient service and feeling really good about it. A lot of emotions about my time on service. Um, Overall, I definitely helped some people. I think that some people definitely did better with me than they would have if I had not been there. I think I did my very best, which is the most important thing that I can say. It was not a lack of effort, a lack of preparedness, or uh, a lack of will that drove the bad outcomes where there were some. And so for that, I will always have my pride, and that's a good thing. I also like had some good outcomes, as I said. Some families I was able to call with some good news, and the people I lost were mostly lost without violence and without undue suffering, which is a good thing as well. Overall, we are doing an amazing job fighting coronavirus. At my hospital, delivering great care. I'm sure that's true at most places around the country. We have, in fact, mobilized an incredible amount of resources towards medical care for coronavirus patients. So much so that field hospitals are sitting mostly empty. The Javits Center has an absurdly small number of patients. Although I have to say, having tried to send patients there, I don't know how anyone ever thought they were going to have patients because they won't take anyone who's sick. Which, in fairness, they don't have the resources of a full acute care hospital, so I understand. But it's like people who are weaning their oxygen after getting better already. Basically, patients who are impossible to screw up is who they're happy to take and give oxygen until they can go home on their own. I went by my primary care clinic today, where I work primarily, to get COVID testing. Number one, you probably can't see that because of my incredibly low resolution camera. I have a new phone coming tomorrow, so you'll get higher quality video in 4K. 4K, that's right. If you watch YouTube on a 4K screen, seek help. Um, or just like, oh, congratulations, I guess. I don't want to yuck your yum, if that's what you're into, like by all means. Well, stop by my primary care clinic, I was saying, and talked to my boss about what Monday's going to look like. And she brought me through just how much that clinic has been doing to try to keep our patients afloat in this time of coronavirus, and they're unable to access care very well. We usually have an incredibly active walk-in clinic. We see between 30 and 60 patients a day who have acute complaints, patients with chronic disease who have questions or who don't feel well. And, 4 or 5 a day will go to the ER. And now they're all staying home because, in fairness, we beg them to stay home. We do. Um, but it's tough. Those patients are now being seen by video, and we're doing several hundred video visits a day between the usual chronic visits and the sick people and the other capacity that we've absorbed from other clinics that are frankly closed. Um, and it just brings me back to when all of your resources go into combating a very scary disease, you will have unintended consequences, and the uncontrolled chronic disease down the line is going to be a problem. Primary care is consistently undervalued, and this is no exception. I got drafted to work in the hospital. I helped. I was needed. I saved some lives, but let's not undervalue what I could have done staying outside of the hospital. It's an interesting thing the way we choose to spend money on saving lives. We will spend. My go-to example is when 3,000 people died on 9/11. We spent $2.4 trillion to go into Afghanistan, and that's just one part of the war on terror. Uh, and if we had spent that same amount of money over that same period of time on preventative care, we could have saved many, many more lives than if we'd had a terror attack the size of 9/11 every year for that entire time. I'm not trying to say that dying from diabetes is the same as dying from being murdered senselessly. I understand that there's an emotional difference and a justification difference, and that to some degree, diabetes feels different. It's less scary, it's more predictable, and it feels more like you have responsibility for it. Although We can have a whole separate conversation about that. But my point is, we need to be intentional about where we put our resources, and we need to figure out what's important to us. And acting out of fear is always going to make us feel stupid because we are stupid when we act out of fear. Doesn't mean we don't have to save lives from coronavirus. Doesn't mean God, the social distancing seems to have been incredible. If you look at New York's curve, it seems to really have been incredible and to very possibly be worth the economic cost, although we'll see the long-term analysis. Someone will have to explain to me so I can understand it. But I am not looking forward to the uptick in advanced cancers and decompensated heart failure and all of the other sort of preventable admissions that will start trickling um, in a couple of weeks when they can no longer stay home and when coronavirus has ticked down just a little bit. It's not going to be great. But I mean, this was never going to be great. So I guess what did I expect? It's a trade off, and we made our choice. But I think more intentional planning as to how we're going to take care of the patients who don't have coronavirus could have been helpful here. It was really amazing work was done by a lot of people on the ground, but from a higher level, so many resources went into coronavirus that I think we kind of missed an opportunity. I don't want to say that because I wasn't in those meetings. That's my perception, is that we could have been more intentional in caring for sick patients with that coronavirus. Um, this is not to say an amazing job has not been done. It's just saying if that had been coming from on high, that might have been more helpful, as having support from the people at the top always is. As I said, have a lot of emotions. It's been a long 2 weeks, and I'm very excited to sleep for a very long time. I hope you're sleeping in tomorrow too. It's Saturday, after all. Sleeping in Saturdays is nothing more American than sleeping in Saturdays. Nothing more human, really, but still. Um, for my part, I am going to bed tired and happy, which is a good thing, and I hope you are too. I hope you have great plans for tomorrow. Zooming with people you like. If you don't, hit me up. Not really a Zoom guy. I do have it. More of a Google Hangouts person because it's 2003. Did you not know it was 2003? Let me just call you on my Motorola Razor. Not good when you stumble over the line of a joke. And also they have a new Motorola Razor, so this whole thing is just like, God, that's okay. We'll get it tomorrow. Tomorrow with a real camera and some real thoughts about coronavirus. But thank you for listening. I hope these videos have been helpful in understanding what caring for coronavirus patients is like. And if nothing else, they've been really fun to make. I'm going to keep going indefinitely. Eventually, they'll stop being called COVIdeos, but they're fun to make, and some people enjoy watching them. So, thanks very much.